Welcome back to the second half hour of Atlanta and Company. I'm Christine Pilara. For over 15 years, American Health Imaging has provided quality diagnostic imaging at an affordable cost. So how do they do it? Here to explain are Director of Insurance Benefits, Julie Strickland, and Chief Operating Officer, Dan Ballantyne. Welcome back to both of you. Great to have you.
Thank you.
Well, for anyone who missed you the first time, tell us more about American Health Imaging. What are you all about?
So American Health Imaging is Georgia's largest network of non-hospital outpatient imaging centers. So we've got, we started in 1998, one little center down in Decatur, Georgia. We've grown over the years. Now we're up to 10 centers here in Metro Atlanta. We've got centers outside of Atlanta as well, but obviously for purposes of today, those are the 10 we're really focusing on.
Sure.
But non-hospital is the key.
Okay, and you talked to me about this being, largest network of non-hospital imaging centers. Why is that important to us, to your clients?
Well, I think the key really these days is cost. The hospitals just are able to bill at such a greater rate than we're able to. And what most people, most patients probably don't know is that the hospitals have been very aggressive in gobbling up a lot of the other companies in town. So it's kind of left us, and though that's a great thing, it's really put a lot of patients in a tough spot when it comes to going in for their MRI and having to spend a whole heck of a lot more money.
Right, and talk to me about that money. What kind of savings could they have with American Health Imaging compared to a hospital-run MRI facility?
So it can be significant. I mean, obviously, one of the things that's happening is you're seeing everybody go into these high-deductible plans.
Right.
Generally speaking, as an outpatient center, and as a non-hospital outpatient center, we can get reimbursed anywhere between $500 and $600 for an MRI, whereas a hospital is getting between $3,000 and $4,000 on that same MRI, on the same equipment, typically same radiologist. It's pretty substantial, and even if you have a copay plan, which is the plan we all kind of grew up with,
right?
Imagine 20% of that. It's pretty significant.
Right, exactly. It's sinful when you think about it. And the position that you are putting a lot of patients in, not you, the system is putting the patients in. And Julie, now turning to you as Director of Insurance Benefits, tell me a little bit about what you do and how you help your customers, your patients.
Well, what we do is when the patients come in, for every patient, we verify their benefits. So when they come in, they know what to expect to pay, if they have a deductible, co-insurance, or even a copay. And we let them know that when we call them to confirm the appointment.
Okay.
So there's no surprises.
Good. Yeah, nobody likes that. So tell me a little bit about how that insurance side works when it comes to people needing an MRI or a CT. Kind of walk us through the process.
Well, they'll get the order from their doctor. They'll call us up. We will call their insurance and to see if they have a deductible, which most plans do these days. You have a deductible, and then if the deductible is met, they'll have to pay the co-insurance or sometimes a copay. But we'll find that out and break it down for them, so it's easy to understand, because insurance can be very complicated.
Oh yes, no kidding. And as you're getting back to the high deductible, it's what so many of us are going for, but then God forbid we have something come about, then we're having to come thousands of dollars out of pocket. So it's hard to really navigate through it all. And that's where you come in, because you're able to offer this really low price, but how are you actually able to do that?
I'll chime in too with what Julie said. I think that one of the things I encourage people to do is be an active shopper for your health care. So if you want to know how much it's going to cost you, call us. We can put you in touch with Julie or anybody on her team to help you better understand, okay, why is it costing me this much? Again, I would encourage you to shop, because you can call the hospitals. I promise you will get a very different answer. So, take control of your health care and actively seek out the answers that you want before you go have an exam done.
Absolutely. Most important question, right. Just being your own advocate, because, it is so much to decipher and to go through. And you mentioned something about the equipment. So it's the same. It's not like we're getting subpar equipment.
No, it truly is the same equipment you're going to get at the hospital. All of our equipment is ACR accredited. All of our radiologists are subspecialized radiologists doing board certified work. All of our technologists are ART accredited. So you will not experience any deficiency in the treatment that you get when you come into one of our facilities. And oftentimes our radiologists are the same guys reading at the hospitals that you might otherwise go to. So
fantastic service. And where are you located?
So now we've got 10 facilities around Metro Atlanta here.
There you go, cheat sheet for you.
We've got Augusta and Canton.
You have to have all those memorized.
Decatur, we've got a new location in Dunwoody.
Awesome.
Fayetteville, Lawrenceville, Noonan, West Cobb, and we've got 2 new locations that we've partnered up with some physicians in Hiram and Marietta. So we're hoping to have a few more in the marketplace here soon, but
Excellent.
we hope to be able to take care of people at any one of those locations.
Absolutely. I'm going to the Dunwoody one because my back's been hurting. Okay, can I go with you?
I told you,
Is
all
that good?
you got to do is call.
Okay, if you would like to contact American Health Imaging, please give them a call now. It's 855-MRI Choice, or log on to AmericanHealthImaging.com. And this segment was paid for by American Health Imaging. Great information. Thank you again.